Hello guys, this part we will talk about clinical manifestation, complications, and examination. First, we look at the clinical manifestation. First one is digestive systematic manifestation. 1. Abdominal pain. It is often on the right lower abdomen, dull pain, and intermittent attack. Some patients have pain patients. After eating, have the abdominal pain, but after defecation, the pain relief. 2. Altered bowel habits. Some patients will have the diarrhea, most often in ulcerative ITB. And some patients will have the constipation, most often in hyperplastic ITB. Some patients will also have the diarrhea and constipation. Third one, abdominal mice, more often in hyperplastic ITB, more common in right lower abdomen. The location is fixed. Now we look at the systemic symptoms. We focus on the tuberculosis toxemia, more often in ulcerative ITB. The patients will have chronic irregular low fever, night sweats, weight loss, anemia, and fatigue. Next part, we talk about the complications. Complications most often in advanced stage. The first one is intestinal obstruction. Just now I show you the picture and colposcopy. The lumi left only part. If it is serious, will be the intestinal obstruction. 2. Tuberculosis peritonitis. We called TBP for easily, most in ulcerative ITB. The third one, fistula abdominal abscess and intestinal bleeding. These complications are serious, but they are not common, they are rare. Okay, let's look at the examination. First part, the lab examination. The ESA indicator will be increased significant. And the next part, the tubulin test, we also called PPT. If it is beyond 5 milliliter, means positive. Look at the picture in the bottom. This size is 18 milliliter, so we say it's positive. And the next examination is T-spot test. It is T-cell detect technical using the specific antigen of TB. It is sensitive and specific. Next part is the most important for diagnosis. Under the colonoscopy, we can see intestinal mucosal congestion and edema, pre-intestinal ulcer, and inflammatory polyp, never lumi. And here we can take the tissue for the next examination, for the histological examination. If here under the microscope we get the kinesis granuloma, we can confirm. This is the key point, so you should remember. And here I take some picture to show the ulcer. The left picture is Caesar tuberculosis. We can see the mucosal edema and multiple ulceration. The right picture is ileocecal tuberculosis. And this picture, the location is ascending local tuberculosis. You can see the ulcer region. This picture is ileocecal tuberculosis, and you can see the ileocecal wall. This part is over. Thank you for your listening. See you next time.